Hello, fitness and rehab subscribers. This is Rick Casalge. I'm here with a really quick interview with Jenny Blackham. She is one of the presenters for the 2009 Exercise Rehab Conference. She's coming out from Victoria to present to exercise professionals on fibromyalgia, and specifically fibromyalgia and exercise, and how to help your client manage and overcome fibromyalgia. So I'll get Jenny to introduce herself and a little bit about her background and her story on her passion for fibromyalgia and working with fibromyalgia clients.
Hi, Rick. Well, this is Jenny speaking, and I'm just going to give you a little background on myself. I have personally had fibromyalgia, and even though the medical profession has said you can only put it into remission, I seem to be absolutely fine and have a lot of clients that are fine. I have been working with people with fibromyalgia for around 16 years now, and in that time, of course, have picked up a lot of things that I feel that doctors are missing. What you will receive when you come to the course is how to recognize the signs and symptoms of fibromyalgia, and there will be a lot of lecture component in this, so that by the time you're finished, you're going to have a very good in-depth idea of what fibromyalgia is all about and how to handle people that have fibromyalgia. You will also learn how to assess the individual, the do's and don'ts when training an individual with fibromyalgia, and that will be also, there will be handouts given from an aerobic class setting, from a personal training perspective, and also in a weight room setting. So you'll have all three different components there. There will be special do's and don'ts when it comes to certain exercises, stretching and training techniques. And there will also be towards the end, so that I know that you guys have got it, we also will break up into small groups, and you'll be given case studies, scenarios, and then you will put that down on sheets of paper in your groups, and then we'll pop it up and just see how much you've taken in and go from there. Fibromyalgia broken down very quickly, it means pain in the fibrous muscles and tissue. Most of the time you'll hear people say that they're in pain all over. I was diagnosed myself in 1991. Once I'd had the diagnosis, I realized that I probably had it since about 1987. And I'll give you a good background on myself and the lead up to that and my diagnosis and what I did afterwards. Some of the things that you will be receiving from this workshop is not offered in any books on fibromyalgia. I've had it described as being cutting edge from one doctor, in that from specializing now with this for 16 years, there are certain do's and don'ts when it comes to exercises, which I will be giving you, so that will hopefully help reduce the pain of your fibromyalgia client and give them hope that it will be a positive experience rather than going home and going to bed for 3 or 4 days because they've been given the wrong exercise or the wrong stretch. I am obviously from England. You probably can gather that. I myself have had a very colorful life, which has helped me tremendously in this kind of work. I am a certified BCRPA certified personal trainer, fitness instructor, strength trainer, adapted fitness trainer, seniors instructor, osteofit instructor, joint works instructor, YMCA fitness instructor, and UBC peer counselor. And I found from a mental and emotional aspect, which I will be sharing with all of you, that is huge. And some of you who have already worked with people with fibromyalgia may already have a little bit of understanding. So it'll be very interesting to meet all of you, and you will learn. Hopefully you'll take away and learn an awful lot about fibromyalgia and feel fairly confident about the people that you're working with. As some of you may have found that fibromyalgia people that you are working with, some of them seem to take 3 steps forward and then they seem to take 4 back. And hopefully I'm going to give you some insights on that so that that does not happen. I'm looking forward to talking with all of you. I really enjoy questions being asked. You will get, as I've mentioned earlier, different handouts that will help you with your clients. And also I will be bringing over a check mark sheet that you will be able to give your client, and they will be able to tick off some of the symptoms that they have, which is also going to help you in your assessment. And we will be going through assessing the individual that has FM a lot. We will also be going through different exercises that are okay for people with fibromyalgia and some that are definitely not okay. And as I mentioned earlier, you will get a handout in aerobic class setting and in personal training setting and in the weight room. So I will end there, and I'll look forward to hearing from you and seeing you at the conference on March 28th. Thank you very much.
Excellent. Thank you very much, Jenny. This is Rick Casalge. We look forward to seeing you at the Exercise and Rehab Conference on Saturday, March 28th, 2009 at Douglas College. Jenny Blackham will be talking about fibromyalgia. She has a passion and experience when it comes to fibromyalgia. She'll be presenting on a session called Fibromyalgia and the Fitness Professional. If you're looking for more information on the conference, the Exercise Rehab Conference, and Jenny Blackham's session, please visit exrehab.com. That is exrehab.com. And there's a full outline of the variety of sessions that will be happening on March 28th. There will be a release technique and a Parkinson and exercise session on March 28th, and then on March 29th is a full day course on joint replacement. So visit exrehab.com to get more information. Thank you very much. This is Rick Casalge signing off. Thank you for continuing to read the Fitness and Rehab newsletter. We will talk to you again soon. Take care and bye-bye.